Lockdowns, stay-at-home orders in effect around the globe as governments try to figure out how to deal with the coronavirus pandemic. Not everywhere, though. The country of Sweden is not relying on a lockdown. As a matter of fact, what they're saying is they're relying on individuals to follow health guidelines and abide by restrictions, including social distancing and limited gatherings to under 50 people. Schools, restaurants, and shops remain open. The Scandinavian nation, with a population of just over 10 million people, has seen about 9,700 cases and, up to today, 870 deaths. Now I'd like to bring in Dr. Ricard Vedin, who joins me now from Stockholm, Sweden. Doctor, welcome to Chasing News. How are you tonight?
I am fine, thank you.
So Sweden has done something that most other nations have not done. There was no lockdown. There was a conversation about social distancing, some restrictions in place. But let me ask you, as a doctor, what are your thoughts on the government's response to the pandemic?
I think the vast majority of Swedes are for the authorities' recommendations. Like everywhere else, there are people against it, but no, the general feeling Swedes are for it.
Your chief epidemiologist suggested that 40% of the capital may well be infected by the end of April, which would change those numbers. You've lost 800 people to this point. Do you still have confidence in that? And do you think this is a good lesson for the rest of the world, that you're not experiencing the economic trauma that everyone else is going through?
We don't know the true answer of this question in a couple of years, but the feeling right now is that our numbers of deaths are going down. We feel that we have this under control. I've been working last night on our intensive care units, and we have a slightly decreased number of patients. We still have places in our intensive care units. It's healthcare is under heavy pressure, but no panic. No, I think that we have this at the moment under control.
What is the feeling on the streets of Stockholm? Is there a general relaxation among the citizens? Is there a confidence?
Yes, I believe so. It's confidence. The bad thing, though, is that this disease has entered our retirement homes. And that explains a lot of the deaths. The Swedish authorities haven't been able to reach 100% of the population with information. We have a lot of immigrants right now not fluent in Swedish, and I see that also in what patients come into the hospital.
Okay, doctor, I really appreciate you joining me tonight. Thank you, and be safe. All right, let's bring in tonight's A+ panel. We are joined by Bob Bianchi, former prosecutor, now defense attorney. Good to see you, Bob.
Good to see you, Bill.
And Lisa Durden, social commentator. Good to see you, Lisa.
Of course.
Lisa, I'll start with you on this. When you look at the population density, clearly a lot lighter in population than New York City, but it does raise a question when you look at certain places in and around our area that maybe this would have been a smarter tactic than to shut everything down.
That's a negative. It really bugs me out that the World Health Organization made the recommendation for all countries to shut down everything, but Sweden's foreign minister, health minister, prime minister, and their epidemiologists still pretty much stuck their middle finger up at folks and said, we're doing it our way.
My concern isn't, are we doing okay because just a few people are dying? I don't want anyone to die. That's the goal that I would try to have. Now, of course, making the analogy between what's going on in Sweden and the United States versus North Korea are all apples and oranges. The density is different. So Sweden may be in for some pain down the road because they didn't take these proactive measures. That would be my concern.
Of course, we're going to see which strategy worked the best over the next few weeks and months for sure. Thanks, guys.